Hi, I'm Annie Laverty, Director of Patient Experience at Northumbria. The fact that you're watching this video at all means that we've been successful at winning an award today. So first of all, I just want to say a huge thank you. It means a great deal to me personally, but also on behalf of our staff who have worked so hard. The second thing I want to say is I'm just really sorry I can't be there. I know you're going to have a cracking day. I'm out of the country, but I'm certainly with you in spirit. Okay, so just to tell you the story of our first year of making 7-day services work in emergency care. This is our geography, a vast patch across Northumbria. And so we had 3 district general hospital sites, all with emergency care departments. This work has involved consolidating those into one emergency care hospital. That hospital responsible for acute inpatients and all emergency care admissions and hot diagnostics, with each of the base sites, if you like, now urgent care centres. So we opened in 2015, have to say a phenomenal amount of planning behind that. I would estimate at least a decade's worth. The commitment and energy shown by staff in the design, plan and delivery and sustaining of high standards has been outstanding, and arguably the thing I'm proudest of most of all. That new emergency care hospital has 7 specialty wards and enjoys access to medical consultant cover over a 7-day week, 24 hours a day. So just reflecting in that first 12 months, we know that we saw close to 82,000 people. Of those, 54% did not actually require admission into hospital. 3/4 of them discharged directly home, whilst about a fifth, 22%, moved on to one of our base sites, another hospital within the Trust for ongoing care and rehabilitation. We performed an amazing 5,000 emergency operations, 800,000 urgent blood tests ordered, and over 8,000 blood transfusions. So over 2,400 new babies born within Northumbria too. So the numbers and the activity, along with the rest of the country, I know, has been extraordinary. And that level of activity, that demand, has certainly brought its challenges. We are now the largest emergency care hospital receiving department in the Northeast. And that consolidation, although right for patients, giving them the best access to a rapid response and consultant cover over a 7-day week, also means that all emergency care ambulances come to one centralised point. So that's presented for us great challenges around emergency handover times, and we've had to do a lot of improvement work around that. Planning on paper is a great thing, but not how it turns out in reality. Something different altogether sometimes. So certainly our people walking in to receive care within the emergency care department has been far higher than we anticipated for what was designed around blue light ambulance access only. And while we've undoubtedly recruited a great cohort of staff who like rapid, fast-paced emergency care services, the pace and delivery has been something completely different. And so we've been very mindful that in itself, if you are on a ward and you are discharging 30 people every day, that pace can take its toll, and something that we've needed to be very mindful of. Both the scale of the change and allowing staff and local communities, populations to be aware of the new service delivery model and where to go to get the right care at the right time requires a massive communication and ongoing communication effort. And we're very privileged to have an exceptional communications department who have a sustained campaign to get that information out there. But it's not only just been about communicating the new way of working and where people needed to go, but also how we can engage and connect with local communities so that this hospital feels very much like their hospital. And so we have had local artists, local photographers bringing their work in, winning competitions, putting their mark on a local hospital. We've had local children name our children's wards and be part of designing and making papier-mâché models of what the hospital should in fact look like. We've invited older people to come in and design our menus and create responsive services in terms of meeting nutritional needs. And that investment in communication, something that it doesn't go away, it's something we're going to need to keep doing to make sure the ownership and the response to the emergency care hospital is welcomed. There's lots in this work that I am very proud of. I'm proud that in that first year our staff were able to respond to a massive increase in terms of activity and still deliver on quality. So one of a handful of trusts in 2016 who delivered on the 95% target. We've seen activity increase further in year 2, and that's brought further challenges and a new response from the trust in order to ensure that we respond appropriately to that demand. It's ongoing work and we're learning all the time. We've been able to successfully, and this is out of step with a national trend, see a 14% reduction in emergency care admission, and that's resulted in a 6 million saving for the local health economy, something that is absolutely right for patients. That ability to turn people around quickly is dependent on access to the right specialist help every day of the week, and we've been able to provide that senior clinical decision making in one place, week in, week out. And our response within radiology has been truly transformed. So 80,000 examinations performed, but much quicker diagnosis, treatment and decision making available for our patients. And that is the ultimate test for us. What do our patients think of the new way of working? Well, it seems they like it. Most of our patients will have been seen through the Northumbria. 80% of people responding to the national survey would have accessed care within the Northumbria. And that saw us rank within the top 10 organisations in the country out of 149. At a question level, you can see the scores in green where we are statistically better than other parts of the NHS, and that showing a big leap in just 12 months. So almost 40% of questions now statistically better, whereas the year before that had only been the case for 10% of our answers. Each of the core domains measured by NHS England around a high quality patient experience within the top 20%. And we've seen real step-like changes. So dealing with and providing environments that feel safe, that provide protection from noise at night, big leaps in 1 year. Cleanliness up from a high baseline. But that engagement with local communities about the food and what the menu should look like, that paying off too, seeing an almost 9% increase in 1 year. Stuff we're really proud of. We have our own patient experience programme, and each of those things marked with an asterisk, statistically better than the year before. This gives us the evidence that we've made an important start. This award that you've kindly given us was for laying the foundation. We're mindful of the challenge. We're mindful there's still much work that we need to do, but we are very proud of the scale of change and the response of clinical leaders within our organisation. There's something very special about being able to safely open one hospital when you're not afforded the opportunity of closing the existing hospital, and make sure that you transfer some of your most sick patients into where they need to be. And to do that reliably and safely is something we managed from day one. And we're exceptionally proud that our patient experience and the feedback continues to suggest that we've made a great start, and that we should continue to do what we set out to do when we first started planning this 10 years ago. Thanks very much.